And welcome back to Live from the Heartland. We're really doing the co-host thing here today. Michael started it off. Chris Colgan will be the third segment, and I, Katie Hogan, am hosting and interviewing our guest today, Dr. Laura Chamberlain, not Green. Dr. Laura has been with us here before over the years. Dr. Laura is a long time good progressive activist. You brought Dennis Kucinich to this stage.
Yes, thank you very
which
much.
was really fun.
Nice to be
have
here.
Him. And it's great to have you. We've done maybe 3 shows that include various people talking from their angle about the healthcare reform proposals.
Right.
Last time we had 2 sisters who are working in the legislature in Springfield with their work. And I know you're focused on the national health care reform legislation
Right.
and how we should get educated.
Absolutely.
And I'm so with you on that, and I would like for us to help do that here on WLUW on Live from the Heartland. So listen up, folks, because this is about your health care, which this year is the year that we will finally get some health care reform. Do you not agree?
Hopefully, actually, when you look at Congress, it's actually looking a little bit dark right now, whether we're actually going to get anything.
All right, talk to us about that.
Absolutely. So this is really, really important. I think that, we certainly have Obama's desire to move some kind of healthcare reform.
Right.
We have a national emergency. There is no question about it. The cost of our health care is rising so fast that it will, we've got some figures here, it will take over our economy in the next couple of years. In 2008, total national health expenditures were expected to rise 6.9%, 2 times the rate of inflation. And total spending was $2.4 trillion in 2007, or almost $8,000 per person. And total healthcare spending represents about 17% of the gross domestic product right now. It is supposed to rise to $4.3 trillion in 2017, so only in basically 9 years, or 8 years. $5 trillion by 2020.
I think we're going to be dead then.
Totally.
Okay.
It's 21% of the GDP. It is unsustainable. You
Right.
can't be spending that much on healthcare and having a vibrant economy. It
Well,
will just bring it down.
It's also been the cause of so many people's bankruptcies.
Absolutely. Absolutely.
And businesses shutting down.
That's exactly right.
So how do we fix it, doctor?
Absolutely, absolutely. So there is no question. I'm a member of Physicians for National Health Plan and program, and there is no question that the best fix right now would be to trash this complex, very scattered, very fragmented healthcare system and institute a single-payer plan, like they have in John Conyers' bill, H.R. 676.
Yeah.
There's no question. That is the best solution. That is what every other country in the world has done.
I hear a but coming.
Absolutely. Absolutely. I just want to put that out there. There's absolutely no question. So I've been, and thousands and thousands of activists around the country have been calling for single-payer reform, single-payer reform, single-payer reform.
Dr. Quentin Young was
Dr. Quentin
his,
Young,
his call.
absolutely. There were doctors in Congress that were arrested recently at hearings for not having a seat at the table. There is just absolutely no question. But I want to tell you what's going on in Congress. The Senate is completely against that. There's only one senator. We only have really one senator that would be for a single-payer.
Who dat?
That is Bernie Sanders from Vermont.
Oh, our good old Bernie.
Absolutely. And he put in a bill, S703, a single-payer bill that would actually allow administration at a state-to-state level of a single-payer plan. But it is a single-payer plan.
So that's not going to pass, right?
No, not in the Senate. And the reason is because the healthcare industry, the health insurance companies, the pharmaceutical companies, the big high-tech industry, medical industry, has the Senate in their pocket. They have spent so much money in campaigns and lobbying that they basically have bought the Senate.
When are they going to run out of money like the rest of us?
You know, this is a very, very important question, because now that we can see where we're at, we have a populist president, right? We put him in the White House, and there's the majority of Americans are for single-payer health care. Survey after survey have shown between 55 and 60%. We even have a majority of doctors, 59% of doctors now agree single-payer is the best option, because they're tired too. They are, they're beaten down by daily calls to the insurance company, begging for care for their patients, arguing over. 1 in 4 medical bills that are submitted by doctors are flatly rejected by the insurance companies just to see if they can get away with it. So the doctors themselves are fighting every day for their own nickels and dimes. So they're sick of it too. And and I'll talk about the AMA later, but so everybody's sick of it. Everybody wants single payer, but we're not, there's no even viable, they're not even talking about it in the Senate. There's some talk in the House, but they're not even talking about it in the Senate. And so what that means is that the health insurance industries, the pharmaceutical industries are too powerful. And we have to cut their power somehow by cutting their economic, basically by cutting their economic power. And to do that, some activists are talking about trying to get in a public option that would be competitive with the insurance companies and drive down their little piece of the pie.
Right.
Yeah. And also very, very important to be able to negotiate with pharmaceuticals to drive down their piece of the pie. So this is what the, kind of public option people have been talking about.
So the public option refers to both the feds taking a hand, in other words, joining hands with the insurance companies in the unwelcome to the circle.
Right.
And also having negotiable drug abilities.
Absolutely. It would be
pharmaceutical.
There's all sorts of interpretations what a public option is, okay? And I'll talk about those different interpretations.
You should talk about those now.
Okay, I will. Okay. So number one, Kennedy and Dodd have put out a plan, and they talk about a public option in that plan. This is in the Senate. And basically, it's the Massachusetts Health Plan. And what that is mandated insurance. It's very important. People listen to this, okay? Mandated insurance. Everybody would have to get some kind of insurance. And if you don't get it, you're faced with a fine in Massachusetts. So if you show up to the emergency room in Massachusetts and you don't have health insurance, you get fined. And it's not a small fine either. It's like
what do they have to pay for this
above
mandated?
$1,000.
What do they have to pay for the mandated health insurance?
Well, that's it. Is that there's all sorts of different plans. Okay. They haven't reduced the number of plans in Massachusetts. They've actually increased it. So the complexity of the system has actually increased. And this is really important because in a single payer plan, the complexity of the system would diminish. It would become more simplified and streamlined. And that's where we would save just millions and millions of dollars on decreased paperwork, decreased billing, decreased
bureaucracy.
Bureaucracy, administrative charges. So in Massachusetts, they're actually facing a economic crisis now because their plan was not able to control costs. It was not able to control costs. So the costs are escalating. And what they're doing in Massachusetts is they're actually skimming money off of the safety net healthcare system, the community hospitals, the community centers, and the not-for-profit hospitals. They're draining their funds to pay for subsidizing insurance for the masses of Massachusetts who have not been able to afford their insurance, and so the money is going to the private health insurance companies and exactly in the wrong direction.
It sounds like it.
Totally.
Okay, so that's Massachusetts.
That's Massachusetts' plan.
We
That's
don't want
Kennedy
that.
Dodd's plan. Please.
That's Kennedy's plan?
Yeah, that's Kennedy's plan, and I want everybody to really understand a few issues about a public option.